Ashafo motion Katanga television as wajibre. Now wo shesha so see streaming live on Twitter at Katanga television with me a shejumedi. Ene e Ghana ni so ye ba bebo enkomo. Enkomo na ye ba bebo no e ya de bia e bit sensitive. Enti misresa se obi hye na se bia nipa no e go through such condition de ye be ka che one se ye de odo ene sedie e brewo. Na yebeka se nyame nka wo ho enida so wo ho nti obi bia nhye no so sanfam sanso na se obi ahwere ne de hye bi wo sa condition we ho a yeka se nyankopon enkoso a enkyekere wo re we Ghana ni midinde abenachi boache enen komo pa ye bebo personally minim oyonko bi a ohwere ne ba a na wadi mfie aduonu baako na ohawa wo femu no na nya asem ketewa ogini ye edu point bi na fe kwambo musi wo mu hu hye latter part no na ye hu se eye lupus se nipadua no akwa no anase emo anase obi bekasa sojafo a ewo nipadua no akutia nyarewa no afede na enumom akutia tissues any cells na ewo nipadua no enti me fa ne se esen ne ketremanya ntokwa ye se wo mu asiesi ba we die abedane entokwa pa wo nipadua no mu a afi hwan e na ba be pata ama no ayeye enti eye bosumi we sei eye lupus awareness month enti sankomobo na ye ba bebo na fortunately on our side no ye wo eye roba somo no bia wo no ye ka eye sa ohawi a ebi wo na so a o go through ene ye ne be bonkomo nti na make say eni da so ho arishimu so sanso na ye eye medical doctor so e wo ha say ya ono so ye ne ba be bonkomo nti wo me extreme left eye doctors mayor or ye person living with lupus or sanso eye member of the Resolute Initiative nti ene ye be share eye Resolute Initiative no ejina homa den eden na omoye sanso ne ye wo Dr. Kobina Esilfi Esilfi Kwe also a medical officer at the bank hospital and paying for me mama kwaba libia boko dear dog adena umfanti dina emu odusa dog so why fe the first time I made a share when you look beautiful. Thank you. Okay, me ba wo so na me ne wash ase ba me mbisa dog lupus efri hefa eneba.
All right, good morning to all the viewers. Into lupus, no, let me just give an explanation of what lupus is. The lupus, no, full meaning is systemic lupus erythematosus. Your friend is SLE. Into ABI, I won't say lupus that, but what's the SLE? Into sal lupus, no, what is lupus? So lupus, no, it's not a disease that anybody wants to have. Lupus, no, it is a chronic disease. It causes autoimmune dysfunction. Inti say, kase obi wo lupus. I just say he has a disease. His own body is fighting against him. Inti everybody has BBI white blood cells. Inti white blood cells, they are the soldiers of the body. Only a policeman of the body. They fight against infection, viruses, bacteria. So that when we have all of these infections, we don't get sick. However, in lupus, there's a problem with these policemen of the body. Instead of fighting against infection, no, they fight against their own body. And they fight against the heart, against the stomach, against the kidney, against the lungs, against the skin, against the brain. It affects every part of the body. It's systemic. Well, it can affect.
For instance, it's me affecting your brain without an ember lungs.
Yes.
And yes, sir.
Yes.
It's from your brain, no, near other organ.
Yes.
Near the other organ. Sir, meet me. Yanasi, bet me. I can say from your hair to toe. It's me, eka baby.
Yes.
Wow.
Yes. It can affect any part of the body. Any part of the body. It can affect the joints, which is one of the most common places it affects. It can affect the muscles. It can affect the skin. So a lot of people with lupus have skin lesions. It can affect the brain. They can get strokes. They can get seizures. A stroke. It can affect the heart. It can affect the lungs. It can affect any part of the body.
Why are there? What's all kind of stroke? What's that chim say? What kind of seizures? No, what kind of stroke? Why are there? Oh, okay. Dog, remember what home? Remember Dog Castle. At what point and I won't say lupus?
Okay. You diagnosed me in 2009.
2009.
Yes.
Okay.
And now I'm 33 years, since 14 years ago.
Wow.
When you diagnosed me. But time now I was secondary school, and I'm a tired. I had to say pompo. I na ye baby visa. Until I was always going me coffee na my school. But now you at the call. Until me real secondary school now me call university level 100. And doctor friend be a refer me to college. Until a hot and I'm diagnosed. 2009, I've been living with lupus till now.
Wow. Abra ye diagnose wono. Apart from say be adene sisi wo hono. Na internally no, na wo feel bibi wo mu.
Yeah, me hair loss. Timitini say me trinyo me de mensa kan na eyi.
To say obi o cancer no.
And some parts are red. Scalp no. And me na butterfly rash. Until the 100 okay, me de mensa be ye cool. And a debia me yare. And I'm a baby kids way be now one bread. And I'm a blood level since it was down as low as 4.7. Yeah, and I'm a mojano was very, 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 very down. And I'm a joints me swollen me nine debia ne swollen. Me son. Sometimes my troyes and my son yeah, so that's it.
Now, what be who say lupus? Quite person offer so embrace no. Beginning na ye catch wo na no. Ye cheche mu chere na ye ma wo eni da so be say oh e curable. Na at some point so be who say oh e be a enye curable. Mostly na medical doctors o say e manageable. Ye be ma won other supplements binom ne ade a e be ma but say ye be too ase na pa de. And no sir any ho. Saying it's Edem information amount.
Okay, initially no 2009 when yan share me but some nana me me service. Into time more university no me call me fair drew but I was not part of the group. It's na me chedan and I'm a kind but still into time na me service in 2013, I joined the group, the tri group. It's a hope and now more breaking education about the thing. And then I realized there were a lot of people that also had the disease. It's a honor. I began to read about it, and then I forgot about this self-denial. I accepted it, and then my family and I were working on my diet and other things. So that's how I able to break through, but beginning in the day, let me say, I will be in young girl, I'm at university, I'm able life, I'm training and all that. So beginning, but as time goes on,
when you're in depth about it, not fade away. You lead. Okay. Maybe beside the two, and here for now, this initiative a buyer. Why not at the buyer? Doctor, are you aware of the initiative or not?
Yes.
Oh, okay. If we hear and a buyer say no na a resolute initiative no.
Yes.
If we hear idea if we hear for buy.
Into the resolute initiative, your friend Try Ghana was started by Dr. Day, Dr. Jifa Day, who is a rheumatologist in Kolebu. One of the first rheumatologists we ever had in this country. Into at the beginning of her rheumatology consultations, she realized that there were a lot of people coming in with lupus and other autoimmune diseases like rheumatoid arthritis, scleroderma, mixed connective tissue disease, so there are quite a number. And it's a very tough disease or condition to have, like Dorcas was saying. Until she realized, say, these people need support because you can't, this journey, everybody needs help. You can't, it's a very difficult condition to have and bear on your own. Until she started the support group to bring together all those who have lupus, rheumatoid arthritis, and all the other autoimmune conditions to provide support to them emotionally, mentally, and also, physically. She's very easy to reach. Until over 15 years, this support group has been going on, and she's doing a very wonderful job. A lot of patients with autoimmune diseases have become like a family. It's always very easy to reach Dr. Day and other doctors who are part of the initiative like me. Okay. And also creating awareness about lupus and other autoimmune diseases is something that we are passionate about and something that we are doing.
Okay. And see, Dr. Day initiative, and draw attention, and also you had an idea about it. Our cousin, okay, maybe you wanted to embark on such journey. Unfortunately for you, I will be meeting Dr. Day and Emma will draw closer to on one.
I was fortunate to have been taught by Dr. Day during my medical school experience, and also I worked directly under her. And before that, I had heard about Try Ghana and all the good things they were doing. I personally know a number of people who are part of Try Ghana and who always speak of the testimonies and the good things that are happening in Try. And see, when I worked under her, and I just developed the passion and I decided to volunteer with Try Ghana.
Tell me, time and me so say minim, woman beer or Lucy in a bar as a result of a lupus. Now, we are medical doctor no, mami mbisa because some doctor said he can't so. Or boss said no, or hospital no more de later no diagnosis or lupus. Difficult in Ghana for us to, diagnose or be say or lupus because late in a minimum no so no. Just a day no manye. Na bofrano just a whole lot almost spend a lot. Last minute on diagnosis and check and bofrano if we mo. A dear dintina a difficult and I say the right medical center no na yemu en continue mane basana.
This is a very good question. The signs and symptoms of lupus no omodoso and they can present like any other disease via Ghana. It's me presenting like malaria, it's me presenting like typhoid, it's me presenting like even skin rashes. Sometimes the diagnosis is very difficult to make because you can come with just hair loss. Bit me about say, oh, so it's a very difficult diagnosis to make. That is why sometimes the delay. And also the labs to do these things are quite expensive, So usually when you have symptoms, please go to the hospital. Go to the hospital, okay? Because only a medical doctor who is trained can make the diagnosis of lupus. Because the symptoms normally also, you can come with tiredness, like what doctors were saying. Fatigue, you are very tired. You can come with joint aches and joint swellings of the fingers and you can come with skin rashes. The most typical rash is the butterfly rash on the face. You can come with hair loss. You can come with mouth sores. You can come with chest pain. You can come with body swellings. So when you go to the hospital, the doctor will listen to your story. Obey with symptoms. Now he will examine you. So now I show signs and symptoms, looking for things that may cause lupus. Over here, he will order some tests, which include a full blood count, especially on moja level. He will order a kidney function test, especially on kidneys. He will order a urine, especially on Johnson. He will look at your heart. He will look at all of this. And then together, he will put all of it together and then make a diagnosis of lupus. Yes, so you have to see a doctor to make the diagnosis.
So you're certain here, typically, you pay self-medication. Obi on the malaria, which may call a pharmacy. Now I got to test, so will be a may try a pregnancy test normally. But about lupus, into me and yet a self-check and say, me amity fee check and me will lupus. Said Bibisa in your one. And to say, whatever being the symptoms, it could be said be a lupus. But when you any unusual signs be a body no yenquire sabia na yenkonko check it. Yes, sir. Okay. Baby, I may baby sunny a bit sensitive. I mean, doctors I have fachemikakra. Obi ewo lupusa. It's me affected no sebia, having the chance to bear children normally are they affected difficult and what are some of the effects it may ba or be so lupus I mean who bet me answer and I say a doctor bet me the account. Oh, thank God.
Me lupus and some worry.
Okay.
So a banner pregnancy the journey was not easy at all.
I know.
But funny enough for me, Onyema na yese yare na ira.
Maybe to you, no, their work experience say, no. But other people also Eddie be accounts also go through same manner.
I can't.
Okay, maybe the doctor will tell.
Symptoms
I am minimal.
But the struggle is still with the blood.
Oh.
See, even Dr. Dane recommended doctor on Shemi. Now, you plan with the doctors. So indirectly, the doctors will be part
of your journey, no?
Yes. Into hormonal will plan no mama or the exact time.
It's all conceiving.
Oh. But in 1 or 2 of my pregnancies, to me, I meet your targets. Yeah. So pregnancy, to me, easy with blood, So they be me gynae, not or because now with blood level as low as 6, and I was still carrying the child. It's by my first child, me won a preterm, 1 kilo. Yes, I think it was the steroids na me fan. Say ma kwala na ye ketwa. Ti ye ko niko but ene we did 6 years.
Wow.
It's about me second and third child na yare no ye treating me ama say me my fine.
Wow.
It's your mono na steroids na me fan was low. It's in kwala no ba ko me ko full 10. Second one, and I miss you no, a book across so but on also a very healthy. The first one on no ye preterm, but the rest of them fine.
Okay. Yeah, then me say. Indeed, don't answer now. Obeba so say tamana ye chese bia abofra no bi o ebet me have effect be but was what chese see say nyame ya dom waware wawo. Emofra ye wo mo no e possible say ebet me a transfer. Lupus nibi ama womoana.
Okay. So to answer that question, let me use it to talk about the causes of lupus.
Okay.
So that I'll use that to answer that question. Into lupus, we don't know the exact cause of lupus. The cause is multifactorial. That means so many things can cause. Into your genetic aspect. Into the end, said that in cause is hereditary, but your genetic aspect. So that means if you have a close family member who has lupus, there's a chance that you also have that genetic predisposition to lupus. Apart from that, certain environmental factors can also trigger lupus, such as some sunlight. Sometimes so certain infections also can trigger lupus. Sometimes there's a hormonal aspect. All these can come together and then cause lupus. In children, it is directly transferred from the mother
too.
But then the child may have a genetic predisposition.
Okay.
That means he can now onya. Yes. Also, usually in mothers who are being treated for lupus, taking their medications as they are supposed to, and going to the hospital regularly, and their lupus is well controlled, there's a chance the child will not even have any lupus at all. You can give birth to normal, healthy children.
And breastfeed them?
And breastfeed them.
Oh, okay.
And breastfeed them normally. Yes. Oh,
wow.
The only problem is when the mother is not taking the medications, if a baby neonatal lupus, in that one, the child can have some symptoms of the lupus, but that is only in mothers who are not actively seeking treatment.
Okay.
But even with that, yes, the child can still grow and have
healthy life. Okay. Ene minims enche ye de enkomo no ebebe I wish nka ye be bon komo sa na be phone lines because minim say there are a lot of people out there be omo person who be say questions ni ade. But me try my best to say say questions ni nyina me bisa. Me ka say be obi ehye on take the medical lifestyle not serious. Be all case kasa sisi atona kuma so person or join group no easy for somebody to just work to more now. I want to be part of it, baby. I've been getting all these symptoms now. Be through more help, with me and proper diagnosis. And I say be all that. That's what person be join here. Open to all.
Oh yes. So maybe besides 2 questions. So let me address the first. If you think you have signs and symptoms of lupus, kindly go to your doctor and then tell him these signs and symptoms. Dr. Nobeye certain labs, and also if he agrees with you, Obama referral to come to a teaching hospital like Kolebu, where you can we can help you and then do the labs that we have to do to make the diagnosis of lupus. If you already have lupus and you want to join Tri-Ghana, the group is open. We are actually looking for you to come and join us so that we can all support each other and help each other in this journey.
Your registration fee, Biana?
Oh, no. Yeah, well, we'll share our phone numbers with you.
Sure.
We'll also share our email address. We'll share our social media page at Tri-Ghana on Twitter, on Instagram, on Facebook, at Tri-Ghana, Trighana. So just send us a message and we'll teach you how to join us. And it is not just to lupus patients, but to everybody. The group is open to everybody who wants to volunteer, to healthcare professionals, to graphic designers, to journalists, to everybody. Come and let's all help on this journey to creating awareness about lupus.
Okay. Now, which year will be or lupus? Asambe na ya wakache nipa no. Make doctors, yeah.
It's a mistake. A lot of people. So sometimes I try to be friendly. So out of that, I be who say only a new patient. Maybe who say because maybe Jenny so most of the time I encourage people a lot. One thing I have noticed is depression doesn't help at all. So in as much as if you think about it, it's not an easy disease to handle. Yes, you are managing it for life. But we are more worried.
And they affect immune system. We more already never fight.
Now also you're worried. Oh, her immune system. So I encourage a lot of people that it's difficult, but you can still live a normal life. So the glory of God, I'm my first degree, my master's, and I'm with the SPHR Center. I'm certified as an HR professional. I've gone through all these things. I live a normal life. And I encourage a lot of people. Lifestyle, very.
Because with your diet, managing, meaning say. And yet, the Anibiana will be to me, it is who live with.
Yes, I say to me steady as a person.
Okay.
Me say me dick care. Now yet to say ubia be boom me be like na me body. You wear drania me pepper. So you have to steady yourself. You have to steady yourself. Now when drania udia. Okay, now balanced diet, so fruits and vegetables.
And yes, specifically because of lupus, not preventable, but because maybe you might be allergic to and no.
And yes, allergies now. And say, wow, dear, men and me who say, me did bankuni kinkia, send a yemen. And me ye free me diet, I feel okay. And say, wow, now best and not stress. Because in 2018, I was school glorious child. I'm a general manager of the school.
Oh wow!
Now you call to another software. So it was a lot of stress. It's me I fled 2018. Me down colleague 1 month. It affected my brain. Me baby. I couldn't recognize my husband, my children. I didn't know them. Into stress ne dear 2018 and I decided say no, I'm not going to kill myself. Yes, and then I want to live a happy life. Yeah, so when I have the chance to have fun. I do have fun.
Enjoy life, my dear. Okay, and dog, yes, sorry, so Ian Genty. As somebody, but I mean, me per se, dog as TNT will be to one of oh, lupus, my area, Mema Sunya. And I'm Emenya.
So, Bema lupus.
Okay.
But it is rare in men. Oh. Usually, it affects women, especially women of childbearing age. Okay. From the age of 15 to about 55. but bear to me lupus. Even in Kolebu just last month, normal diagnosed a 2-year-old of lupus. And even though it's rare in these ages, no, to me see, and it can also occur in men.
Okay. And sorry program no so no. As I mean, I'll be catching for the awareness month, you know. I mean, education, no, SNK amount for TSA. Now, for number, so be in case any other, organization, institution, be person or because I know say you may also power. It's financially any other way be person the boa number be any panel free.
Just to summarize, this month, no, Lupus Awareness Month in May. You've heard about Breast Cancer Awareness Month in October, Biasha Pink. In May too, no, Lupus Awareness Month. We are encouraging everybody to wear purple. So we share me purple nice. Nice purple dress. This month to help us create awareness, no, we share purple. And also the theme for this month is making lupus visible.
Okay.
That's the international theme. We want everybody to know about lupus so that it can help in the diagnosis and the management.
Okay.
And so we will share our numbers with you. I have it on my phone, so I can give that to you.
Yeah. Ubet me abu bokrani. Yeah.
What numbers? No.
Okay.
Another thing now, social media awareness campaign.
Okay.
You can post it on your WhatsApp status. Lupus Awareness Month. Share pink shares now. They are share Facebook, Twitter, Instagram. Lupus Awareness Month. Now when you say hashtag. Now spread the word around about lupus.
Okay. Number no.
But your number no.
Okay. Ebusiafo said Dr. Ekano. Lupus Awareness Month. Monty. Mama yen try na yen send it. Messages no across no BBR so intimate number no pacho.
Until number is 054 408 9065.
Thanks Subio.
054 408 9065.
Okay. Sa number no one the AD Juma. It will be a frame one mobeje womoso. Meda wasepa doka so meda sepa na mechia or husband only gentleman be but your husband oh wow nyame insure na papa I mean as I said me bisa ukunumpo say o hwe wi you are glowing
oh yeah dear pa
nyame insure no man ahoden na nyame nso ma wo nso ahoden pa nyame insure e mo friend nyina try Ghana executives from Dr. Day to all the other executives are more supporting in us. Nyame inshamo pa doc nyame insha why okay abusuafo doctors mayor person living with lupus osai so member of the Resolute Initiative so ename what Dr. Kobina Isilfie Kwe and so medical officer at the bank hospital and ane omo etwetwe nkomo efa lupus awareness month it's mommy inquire sabia na yekoso we can manage it and we live our life normal say obi bia ono so te won ma dia oni lupus nibi why enye se wunya ya na se bi kwako nemmom anamonto obetu afa ho no ene beboa ama won so watna asemeda wasasa wo jebre na wo hye dwumedi dan ho agye aboafo enkrato che no se dwumedi no guso a ekose beba sesia